Hi, my name is Brianne Allred, and I'm a physical therapist here at Logan Regional Hospital, and I deal with issues related to women's health, particularly those around pregnancy and with pelvic floor issues. I'd like to take a few minutes to discuss exercising safely following the birth of your baby. In this video, we will cover when is the right time to safely begin exercising, weight loss after delivery, restoring strength in your core muscles, plus we'll demonstrate some safe exercises you can begin doing now. Exercise is encouraged and beneficial after delivery, but you need to give your body time to heal, so return to exercise gradually. Resting is also an important part of recovery, so make sure that you make time for it. During pregnancy, your body has changed physiologically to prepare for birth. Some of these changes also make you more susceptible to injury and to blood clots. Your joints and muscles experience laxity due to persistent hormones in your body. This laxity can last for 3 to 5 months after delivery, or even longer if you're breastfeeding. During this time, you're at a higher risk for injury. You are also at a higher than normal risk for blood clots. Watch for swelling, heat or tightness in the legs, redness, difficulty breathing, and generally not feeling well. You should call your doctor if you experience any of these symptoms. You also want to watch for vaginal bleeding that becomes more red, heavy, or resumes after stopping, particularly around when you're exercising. Consult your doctor if this happens as well. You can begin immediately with gradual exercise like walking, pelvic floor strengthening, and abdominal tightening exercises. Pay attention to your body and exercise accordingly. You should wait for 4 to 6 weeks before beginning a vigorous exercise routine if you've had a vaginal delivery, and 8 to 12 weeks if you've delivered by C-section. With either delivery type, you should obtain approval from your doctor about returning to a vigorous exercise routine. Most women develop a gap in their abdominal muscles as their belly expands during pregnancy and labor. This is called Diastasis recti. It takes approximately 4 to 8 weeks after giving birth for this gap to close, and in some individuals it can take longer. Check for a diastasis recti prior to doing abdominal work. We'll show you how to do this. You'll also receive a handout that walks you through this exercise in your Living and Learning Together packet. Lie flat on your back with your knees bent. Place the fingers of your left hand, palm down, just above your belly button. Place your right hand on your upper thigh. Inhale, then exhale. As you exhale, lift your head and shoulders off the floor. Turn your fingers widthwise through the gap, and you should be able to fill the gap where the muscles have separated. If the gap is wider than 1 finger width, you should not perform abdominal crunches or sit-ups. Once the gap narrows to only 1 finger width, you can start doing crunches, sit-ups, and more aggressive abdominal strengthening. If you start doing abdominal exercises before the gap closes, you risk injuring those muscles and separating them permanently, so make sure your belly is ready before you start. Your abdominal muscles were stretched and separated through the course of your pregnancy. In this state, your muscles are often unable to activate and become weak. The abdominal brace or corset exercise aids in closing the gap in your abdominal wall and decreasing your lower abdominal pouch. It also aids in decreasing the possibility of having a permanent diastasis recti. Perform this exercise while laying, sitting, or during daily activities. Tighten your abdominal muscles as if you are hollowing out your stomach or sucking in. Perform a forceful shh. This sound will activate your deep abdominal muscles. Pay attention to how this feels. You should feel your belly button pull inward towards your spine and upward underneath your ribs. You should also feel a lightening in your pelvic floor area as the abdominals lift the weight of your internal organs. You'll want to hold this for a count of 5 to 10 seconds and repeat 10 times. You can also complete this exercise during any activity that stresses your abdominals, as if putting on your body's natural back brace. Examples of this would be before lifting your brand new baby, getting out of bed, or transitional movements such as standing up from a chair or reaching overhead. This exercise is important as it pulls the abdominals together for appropriate healing and tightening. You should not advance to the other abdominal exercises until you can properly perform the abdominal brace. In your Living and Learning Together packet, you'll find these exercises, plus some great abdominal strengthening exercises you can do at home. Be sure to note the abdominal crunch substitute exercises should you have a diastasis recti of 1 finger width or greater along any length of your abdominals. These exercises are safe to do instead of doing an abdominal crunch. You can increase cardiovascular strength by walking. Begin with short distances and increase daily. Walking is a great way to improve gastrointestinal mobility, relieve general pain, reduce the risk of getting blood clots, and helps in healing. Walking is encouraged immediately after delivery. Once your doctor clears you for more vigorous exercise, begin with low impact exercise and progressively increase as your body allows. If you are breastfeeding, consider exercising after feedings for increased comfort. Also, remember for outdoor activities that your joints are loose and more prone to strains and sprains. It is very important that you focus on a balanced diet, getting enough rest, and gently starting back into exercise after delivery. You shouldn't begin a regimented weight loss plan for at least 6 weeks after delivery. If you choose to begin a weight loss plan, limit weight loss to no more than 2 pounds per week. Losing weight too quickly can decrease your milk supply, increase toxins in breast milk, increase mood swings, and decrease energy. If you are exercising, make sure to stay hydrated and eat a balanced diet. Your body will naturally start to slim down. Most importantly, be patient and let your body heal while you're enjoying your new baby.